Okay, thank you, Steve. Well, as the name suggests, we're focused on perinatal research and perinatal health, and with a real emphasis on the translation side of it. We're one of the 12 SFI research centres of excellence in Ireland, and our main focus is translating the research and the innovations of our clinician scientists, our colleagues who are mainly obstetricians, paediatricians, neonatologists, physiologists, into bedside and cotside devices. We work with a number of industry partners who provide kind of critical pathways to market or to bedside or to cotside. So I think quite quickly realised that the burden of morbidity and mortality globally is in low to middle income countries, where the impact of perinatal morbidity and mortality is being felt. So early on we decided we needed to engage. We needed to engage with a hospital-based research facility in a developing country. So we had that goal quite a way back. So even this time last year, we were in discussion with Irish Aid and the Minister, Sean Sherlock at the time, and Michael Gaffney in Irish Aid, discussing our ideas and discussing our plans and sitting down with them and selecting an Irish Aid priority country to try to find a partner in. So we liaised out with them in order to create a long list and then work with the embassy in Dar es Salaam to create a short list. And then we ended up doing a scoping visit and meeting a number of institutions. So eventually we set up a collaboration with the Kilimanjaro Clinical Research Institute. They're based in Moshi, northern Tanzania. They do a range of health research, but including perinatal research, and they've got a very valuable 15-year-old birth registry cohort, which is something that we were very keen to collaborate with them on. So the objectives of the partnership were that we're mutual capacity building, mutual knowledge exchange and collaboration. They're very interested in the fact that we wanted to develop devices to use in low resource, to use in global settings, but particularly be useful for low resource settings. And we were very interested in getting our engineers and our scientists down on the ground in Tanzania to see the actual challenges, the practical challenges of developing devices fit for a low resource setting. We also wanted to jointly build our own capacity in areas where human resources are scarce, and I don't just mean Tanzania, I mean Ireland too. There's not a huge number of neonatal physiologists running around the place in Ireland either, and that's why we're developing these innovations. And eventually maybe, facilitate well-designed, robust collaborative trials in areas where the need is greatest. So the challenge was to find the right institution, as I outlined, and we really worked closely with Irish Aid and the Embassy on doing that. We did a lot of legwork there, producing briefing papers, and the ambassador, they would have helped a lot to send those around to, I suppose, prospective institutions. Another challenge was finding funding to start it all off. So we had some discretionary funding for a scoping visit. And then luckily, we hadn't heard of ESTHER Ireland at this point. We heard about ESTHER Ireland, and we were lucky enough to get some funding to do a follow-up trip and develop an MOU, and we've completed and signed our MOU now. But a challenge will be funding going forward. And we're well used to the funding environment. It's very, very competitive. It's all competitively awarded. So that's going to be a challenge going forward. It's going to be project by project basis. But in terms of advice for others, it's be very, very clear on your objectives, I'd say. And we were lucky that we were a research institution within a tertiary referral hospital and a medical school, and they were in the exact same space in Moshi. We had very, very similar objectives, very similar people. And accept help and support and advice where it's available, such as from the Irish Aid and the Embassy in Tanzania, and ensure buy-in at the highest level. So in our case, it would be the Vice President for Research in UCC, it's their Executive Director in the Good Samaritan Foundation in Moshi, and take all opportunities to build a relationship. For example, we met them up with them in Liverpool last week because we were in Liverpool for a conference, which is something we didn't know about until August. But it was easy for us to spend €100 on a flight, go to Liverpool and have a day-long meeting. So those kind of things help to, build a relationship. And I think critically identify a manageable, doable project that is has a high chance of success and is useful in terms of building the relationship. And that's what we've done from the start, and that's what we're working on at the moment.